Hello everyone, we are here at EuroPCR 2023 and are here today to discuss physiological and imaging guidance of left main PCI. My name is Dejan Milasinovic and I'm from Belgrade, and I'm joined today by Alejandro Travieso from Madrid, Spain. Alejandro, do you use physiological or imaging guidance when you perform left main PCI?
Well, from my perspective is that in order to achieve a good assessment of left main PCI, you should use both, because the information that you gather from either physiology or imaging are complementary. You will use physiology to assess side branch or main vessel physiological relevance, and you will use imaging to guide your PCI.
When we speak about guidance, I think it is important that we understand that we mean pre-procedural assessment that regards, as you said, the significance of the disease, but also the pattern of the disease. Both you can get actually with imaging and physiology. It is just complementary information, as you said. When you say imaging, do you use IVUS or OCT or both when you perform left main PCI?
Well, in that sense, in my center, we mainly use IVUS, but I know that for especially distal left main, if you got a good catheter that allows you to engage and to opacificate the vessel, OCT is also a good option. And it may you even add some extra information that you cannot have with OCT in terms of resolution.
Yeah, as you said, I think and it is important to reiterate, with OCT you may get some information you do not get with IVUS and the other way around. So this is important. When we say complementary, it doesn't mean that you need to use both in the same patient, but you can use different imaging catheters in different patients, for different patients. If you are interested in plaque composition, and that is your main target of interest, for example, in a patient, then OCT may provide you with this information that can help you choose the appropriate plaque modification device, for example. IVUS is very good for assessing diameters and also, of course, looking at the landing zone. So there are different information that you need when you guide and plan and deliver your left main PCI. And I think, and I would agree with you, that the information you get from different imaging catheters, OCT or IVUS, are different, but you can use this knowledge to advance your procedure from both sources.
Yeah,
and
to apply them to the right patient at each time.
Exactly. It depends what question you're interested in. Of course, there is an algorithm when you use imaging, but you can, with both devices, get approximately the same information in terms of the diameter, landing zone, and so on. But there are then specific questions you can address with either of the two. Now, the question is, how is it that you use it in your daily practice? When is it that you use physiology? When is it that you use imaging when you approach left main PCI?
Well, my philosophy is that if I have the technology, I would use it as much as I can. So we would like to do it before PCI to know the plaque distribution, to know the plaque morphology. We will use it in the steps between our PCI phases, for example, in two-stent strategies. And of course, we will always use it at the end of PCI, because it's capital to know what result you have on top of the angiography that does not give you enough information.
I think I would agree with you, and I would then summarize in a way that if we are using physiology or imaging or both, we should use it pre and post procedure and throughout the procedure as well. Now, when we use physiology, the problem is that you can have downstream disease. So I think pullback assessment, longitudinal assessment of the vessel with physiology is important as well, and that can be done before and after the procedure to check your result. With imaging, pre-procedure, you assess the plaque and you prepare the lesion in terms of measuring the diameters, assessing the landing zones and plaque modification strategies if needed, and at the end, you check your result. Both physiology and imaging can be used. Imaging guidance is something which I would be using more routinely, and physiology would be, for now, reserved for patients where I would like to assess the hemodynamic relevance of the disease, but pre and post PCI. Would you agree with that?
I totally agree with you. I think, as we've said, that both information are complementary, and we will always have a low threshold to use them in our daily practice.
Thank you very much. Thank you all. The message, I think, is that physiology and imaging are indispensable tools in our cath lab, especially when approaching complex lesion subsets like left main disease.